Hello and welcome to Elimination Assistance by Haley Howell, Kate Larson, and Rob Gatton. Elimination assistance is a really important key part of nursing care. Patients may have difficulty toileting for a myriad of reasons, but without proper assistance, they're at risk of skin breakdown, infections, and loss of dignity and comfort. So there's a few safety concerns for elimination assistance. One of the major ones is patient safety and fall prevention. You're immobilizing a patient, so just make sure you're doing that carefully and safely. You also want to be monitoring the patient's skin integrity and pressure injury status. So just don't leave them on a bedpan for a long time. Make sure you're cleaning them up as soon as, their bed is soiled, things like that. You don't want to get skin breakdown. And lastly, infection control and hygiene for you and the patient. So wear gloves, practice hand hygiene before and after, and then just properly clean your patients always. As for the role this plays in nursing care, we kind of touched on it previously. It's just going to prevent complications, UTIs, pressure injuries. You're going to be able to assess urine and stool output and see, changes in your patient's health condition. You're also going to be able to teach your patient some safe mobility with this. You're going to start with a patient maybe completely bedbound. You're going to be using a bedpan, or they're incontinent, and then you can progress all the way up to them ambulating all the way to the bathroom and back. One important thing to note is this task can be delegated to assistive personnel. They just need to document their assessments and report any abnormal findings to the nurse. As for specific assessments that we can do during elimination assistance, there's quite a few of them. We kind of already touched on this. So urinary output assessment. How much? What does it look like? Color? Does it have an odor? How often are they going? Same with bowel movements, frequency, consistency, volume. You're also looking at their skin integrity and perineal hygiene. This is really, really important, especially for our older folks. If you get, redness, irritation, moisture in there, their skin's going to break down really quickly. And then you can ask your patients if they're experiencing pain or discomfort with elimination. We know this is a really key thing, something that we should be paying attention to. And then hydration and dietary needs, what we're observing from their output can tell us, do they need more water? Do they need to change their diet? Things like that. Hi, this is Kate Larson, and we're going to be going over perineal hygiene. Your first step for perineal hygiene is ensuring patient privacy, so make sure you shut the patient's door or curtain behind you as you enter their room. Introduce yourself, perform hand hygiene, and don PPE. Make sure you've gathered all necessary equipment and supplies, and arrange them on the patient's bedside table. After you have identified the patient using two identifiers, bring the bed to an appropriate working height. If the patient is able to maneuver and handle a washcloth, allow them to cleanse their perineum on their own. If not, note any restrictions or limitations on the patient's positioning and help them into a supine position. With the patient on a waterproof pad, wash the patient's thighs with a washcloth covered in warm, soapy water. Once complete, thoroughly rinse and dry the area with a towel. Cover the patient's thighs with a bath towel. Gently raise the penis and place the bath towel underneath. Gently grasp the shaft of the penis. If the patient is uncircumcised, retract the foreskin. Wash the tip of the penis at the urethral meatus first using a circular motion, cleansing from the meatus outwards. With a separate section of the washcloth, continue until the tip of the penis is clean. Rinse and dry the tip of the penis gently and thoroughly. If the patient is uncircumcised, return the foreskin to its natural position. Gently cleanse the shaft of the penis and the scrotum by having the patient abduct his legs. Pay special attention to the underlying surface of the penis. Lift the scrotum carefully and wash the underlying skin folds. Then rinse and dry the area thoroughly from front to back. Make sure to observe the perineal area for redness, swelling, irritation, discharge, or signs of skin breakdown that persist after performing perineal hygiene. Once complete, remove the towel and waterproof pad. Pull the patient's gown back down and put the blankets back on top of them. Return the patient's bed to the lowest position and help the patient into a comfortable position. Place their toiletries and personal items, including the call light, within reach. Make sure you take all supplies, soiled and clean, that you brought into the room back out with you. Lastly, remove and dispose of any PPE, perform hand hygiene, and document the procedure. All right, so in the video we discussed male peri-care. So let's talk about a few of the steps that differ for female peri-care. Obviously, there's different anatomy down there. So here are the female specific steps that you're going to perform. You're going to wash the labia majora using your non-dominant hand to gently retract the labium from the thigh, then wipe from the perineum to the rectum, repeating this process on both sides with separate sections of the washcloth. Then you're going to rinse and dry the area from front to back. Next, you're going to separate the labia with your non-dominant hand to expose the urethral meatus and vaginal orifice. Then wash downward from the pubic area towards the rectum in one smooth stroke. Again, you can repeat these strokes just with different areas of the washcloth. Then you're going to cleanse thoroughly over the labia minora, clitoris, and vaginal orifice. Lastly, rinsing and drying that area from front to back again. And then all of the steps in the beginning and in the end that you saw in that video with the male peri-care are going to be the same. As for patient education with perineal care, there's a few important things to mention. Just make sure you're going to explain the care and that it will involve you cleaning the genital area. Explain to them that this care is essential for hygiene, preventing infections, and maintaining their comfort overall. Make sure you assure them that this is a routine nursing task and that it's not just something specific to them. Do encourage communication on their part. Tell them that they can ask for breaks or express discomfort at any time. Go over the steps of the procedure with them so they're more familiar with it and encourage them to participate as much as possible. Okay, so let's briefly touch on the bedside commode just because this is another method for elimination. Overall, it's just going to be a pivot or a little shuffle over to this commode. There's a picture on the next slide of what it looks like. You're going to do all the same things: patient privacy, hand hygiene, safe mobilization, all that good stuff. You can refer to the clinical skills video on mobilization. Basically, you're going to use a gait belt and other mobilization equipment, sit them down on that little portable toilet, get them cleaned up, get them back in bed or back to the chair, and then you're going to empty that out in the bathroom and chart your assessments. This picture here shows a picture of a hat. You can sit it in the front of a toilet or a commode, do urine collection, or you can flip it around, sit it in the back of a toilet, and collect some stool for a sample, things like that. And then here's that picture of the commode and just a few things to mention for patient education.
When assisting a patient with a urinal, you want to make sure that you have gloves on and you've introduced yourself and you have your supplies ready. Then you're going to uncover the patient and maintain as much patient privacy as you can, so making sure they're not more uncovered than they need to be. You can also place a absorbent pad underneath them if necessary, and then you're going to position the urinal correctly. So you're going to grab the shaft of the penis and insert it into the urinal, making sure that it's not in an uncomfortable position for them. And then you're going to cover the patient back up and exit the room so that they can have some privacy while they urinate. And then when you re-enter the room, you're going to uncover them and remove the urinal from where it was before without spilling or injuring the patient. And put the lid back on the urinal and cover the patient back up and perform peri-care. And then once you perform peri-care, you can cover them back up, and then it's important to teach the patient proper hand hygiene just in case they needed to adjust the urinal or if they spilled or anything like that. And then you're going to fully cover the patient and make sure they have their call light and that they're in a safe, comfortable position. All the steps are the same for women, except the urinal will look a little bit different and it will be positioned just slightly different.
Bedpans are a useful tool for aiding patients that have been restricted to the bed and eliminating waste, and they can be reusable or disposable, and they come in two main varieties. There's the fracture bedpan, which is typically a lot smaller, and then there's the conventional style of bedpan. The top image and the one on the left are both fracture pans, and the wider, taller end sits towards the patient's thighs, and that small flat sheet slides under their sacrum. And these are useful for patients that can't bridge at the hips, smaller patients, and for patients that can't move in the bed. The SurePath recommended that all bedpans be rinsed in warm water before being placed against the patient's skin, but in practice, nurses oftentimes put absorptive pads over top the bedpan, because if you look, they have these very thin edges that can cause pressure injuries, and it often makes it more comfortable for the patient to be sitting on them, particularly for patients that take a long time to defecate. And then the other benefit of this is that most people urinate while they're trying to defecate, and especially the fracture size pans won't always catch all of that. And by doing this, you can help prevent having to do a full bed change and, of course, make the patient more comfortable. So we're going to demonstrate how to position a bedpan with a patient that can't move in the bed. So first, you'll lower the head of the bed down and get them into the supine position and uncover them. And then when rolling a patient, you'll raise that knee, and then the behind the knee or the hip or behind the shoulder are all good places to press to help push, which I didn't do a very good job of, while the other person pulls. And then, as you can see there with the fracture pan, you just set the flared edge towards the feet. And then you just have to help make sure that the patient's going to be comfortable, get them covered back up and seated, and then you can leave them to do their business. And before you walk out of the room, of course, you want to make sure that they have their call light and access to their water. And then when they've called you back, you come back, uncover them again, and then roll them onto the side. You can pull the pan out and set it on a chair with a towel or an absorptive pad protecting the chair. And then you can cover the bedpan while you're doing this with another towel. Or you can use it as a place to dispose of your wipes. And then you always want to make sure to try to wipe from the front to the back, and you can clean around a patient's testicles if there's any fecal matter there. This is also a good time to perform pericare if a patient's incapable of doing it themselves. Now, as you can see here, we're rolling and tucking an absorptive pad under our patient. And these are good for keeping the skin dry and for preventing moisture-related skin breakdown, also airflow. In this video, we used a towel because we didn't have a chucks or anything, but you would use whatever your facility provides in practice. And then you also just want to make sure that you roll the patient both ways so that you can see all of the skin and get everything nice, clean, and dry. And then you want to cover them back up, get them back into a comfortable position, and then you're done. And of course, throughout all of this, you're going to be talking to your patient and you're going to be working to maintain their privacy and comfort. But we were working with a mannequin, so we didn't demonstrate that too much. So what happens if a patient can't poop? Well, oftentimes their physician will prescribe them a laxative. And I'm not going to go into what fiber supplements or lubricants do, but osmotic laxatives use ions to increase the moisture content of the stool, make it easier to pass. Stool softeners do the same, but they also increase the fat content. And then stimulants increase the peristalsis of the colon. And then laxatives can vary in the amount of time that they take to become effective depending on which one and the route.